question for you. If somebody comes in here to your clinic and they're diagnosed with cancer, I know you don't have a one-size-fits-all protocol, but give me 2 or 3 generalities that you would do with almost every cancer patient, 2 or 3 things that are really important for a cancer patient to pay attention to when treating cancer.
Well, number one is I don't treat any cancer at all. That's out of my realm. My job is whether they have cancer or any chronic, because all cancer is a chronic degenerative disease process that's happening. That I want to make sure, number one, when they walk in here, that most important thing is their mindset. It is crucial. That if they don't have the right mindset, they don't make it. I always say to them that when you have someone has cancer, you have 3 choices right now. You can do all the conventional, you can do it naturally, or you can do a combination of all of them, right? Or obviously, number 4, you could do nothing.
Sure.
And I always say to them, which one do you think works best? And they always think I'm going to say the natural. And I say, not necessarily. Are there people who do natural and not make it? Absolutely. Are there people who do conventional not making it? And then in the opposite, there are people who made it through conventional. It's very, very rare, but there are a few who make it. Why? Because they're very focused. They know what they want. They're not stressed about it. They see the chemotherapy is going to kill their cancer. They see it as good. They go through it all, but they're also detoxing, cleansing their body, making sure that the toxins are coming in, the toxins are getting out. And
so a lot of other corroborating factors, not just the one treatment. It's a lot of the other externals that will influence, I guess is what you're saying, whether the treatment is successful.
Absolutely, because you toxins coming into the body, it creates cancer. It is so chemotherapy is going to create cancer in other cells just by its nature, being a toxic and a poison. So I have to make sure I'm protecting my body. So if a patient says I want to go through chemotherapy and radiation, and that's what they've chosen, they're 100% in on it. Great, then let's get you protecting your body, detoxing and cleansing it out. But now someone says, I don't want to do that. The number one is, my job is not to cure it. My job is I need to teach them what the cause is. Every cancer has a cause. They're not all the same. So you're right, they're not all the same. Where someone has a breast cancer that's hormonal, well, they have a hormonal imbalance. Right? Their liver wasn't able to methylate as well. They weren't able to balance out their estrogen levels. You take somebody who has leukemia or myelomas or lymphomas. These are immune cancers. A lot of these are from viruses. A lot of these are from nonstop, inflammatory reactions happening in their gut where their immune system's nonstop working. GMOs. These things affect more immune cancers. You have brain cancers, which we know are coming from more of a toxicity issue. I could go through, but every cancer is different. They're not all the same. And so we can't treat everything exactly the same, right? So number one is we got to get to the cause. What caused this? Work on the cause. Then number 2 is now specifically, safely. So I always say that, specifically and safely kill it. And then number 3 is you have to rebuild your immune system, get your body strong again, so it can heal the cancer.
So I appreciate that.